Hello guys, this is Dr. Asif. Today I'm going to continue the playlist, that is short case and long case in the MCPS and FCPS final exam. So as a continuation, you all know that you have seen my video, that is inguinal hernia. So it is a similar or a very likely to near about hernia, that is hydrocele, okay, which is very common inguinoscrotal swelling, which can be given in the exam for as a short case. You all know the short case segment is very tough and challenging, sometimes tricky, so you have to overcome it whatever it takes. So let's start. First you have to make a good rapport with your patient within 1 to 2 minutes. That is, assalamu alaikum, I'm Dr. Asif, FCPS, MS or MBBS and MCPS, whatever it takes, examinee. I will discuss with you about your disease and I will examine you and you will not get hurt. So sir, I need screening and attendant, and ensures I will need screening and attendant, yes, and ensure sanitization of hand and proper exposure, and some questions to the patient. So I have to ask some question. It's not more than 3 to 4 questions, because you are not allowed to ask a lot of questions, because it is not a long case, it's a short case. Okay, what is your problem and how many days you are suffering from this problem, and has it grown slowly or fast, quickly, to differentiate it as a primary or secondary. Is there any history of trauma to the scrotum, or any history of cough, fever, hemoptysis or weight loss. Okay, it is necessary to differentiate trauma or TB or tumor. Okay, what you can see, there is an asymmetry of the scrotal sac, that this is the normal scrotum and this is scrotum but distended. So there is a testis and the part of the sac which contain fluid, so it becomes cystic and enlarges single side unilaterally, that means within the left side. So what are the examinations one? So first you will see, make the patient position like standing positions, and if you have to make your patient properly dressed, that I have shown in the hernia video, and then you will sit in front of him and try to inspect first by scrotal swelling, right or left. It is left sided. Shape and size of the globular in elliptical in shape, or and then the loss of normal rugosity, because due to the distension in the sac or balloon, the outer skin become distended, that's why there will be a lack of rugosity, and penis is deviated to another side or opposite side due to the pressure effect. No visible cough impulse. So I will ask the patient to cough, and there will be no visible cough impulse, and that's it. And the palpation, temperature, tenderness, which will be normal and non-tender. Get above the swelling, I will give bottom of this scrotum by 2 hands. That get above the swelling is possible, and the testis cannot be palpated. Now you cannot differentiate testis with the sac. Smooth surface and regular margin, and consistency is cystic, and the fluctuant transilluminant testis is brilliantly transilluminant and compressible but not reducible. No palpable cough impulse. Okay, so palpable cough impulse will be negative. Then you can see I have make a position of the patient by standing, then get above the swelling done by bottom of the scrotum left, then try to palpate, because you will see there is only spermatic cord but there is no sac, so that means there is no hernia. Okay, and get above the swelling is positive, you can possibly get above the swelling. Okay, then the swelling is identified and fluctuation test is done, then transillumination test, okay, by X-ray film. Now to examine opposite half of the scrotum and opposite testis normal, penis and the external urethral meatus is normal, and the hernial orifice is intact. Okay, Now the presentation. So how can you present this topic? So after the examination, that means when you have done these things, then you have to see also the hernial orifice in both sides, because it's I have told you that sometimes some short cases are tricky, so you must know the tricks. So just to show your examiner that you have been excluded from hydrocele to from hernia, so you will check both inguinal region and give try to say the patient to cough, so that you see the visible or palpable cough impulse in both inguinal region. Okay, and also you will if your patient give you any history of cough, constipation and BPH or urinary discomfort, in that case you will see chest auscultation and also digital rectal examination. You will ask the patients, or you will ask your examiner that I want to perform digital rectal examinations and also want to auscultate the chest. Okay, some of your examiner will say, okay, you don't need to do, patient is already okay, so you can skip it, then you will go for skip. Now the presentation will be, there is a swelling on the left side of the scrotum which is globular in shape, measuring near about 4 to 5 cm. Overlying skin rugosity is lost. Penis is deviated to the opposite side. There is no visible cough impulse. Temperature is normal. The swelling is non-tender. I can get above the swelling and the testis cannot be palpated separately. And the swelling is smooth in surface, regular in margin, cystic in consistency, fluctuant. Trans-illumination test, non-trans-illuminant, brilliantly transluminant, sorry, and non-compressible, not reducible, and no palpable expansile cough impulse. Right side scrotum and right testis is normal, because you have to check the other sides like testis or inguinal scrotal region, that will be normal, but you have to go for examining as a routine performance. Then penis and external urethra is normal and the hernial orifices are intact. Now the things is, what is your diagnosis? So my diagnosis is a left-sided primary vaginal hydrocele. And what is the why it is not a hernia? Why? It is a scrotal swelling, absolutely. I can get above the swelling, so there is no cough impulse, so it is fluctuant, and trans-illumination test is positive. But in case of hernia, it is negative. Okay. So what is your plan? After thorough evaluation and proper counseling of the patient, I will advise for surgery. Then what are the indications of surgery? What is the indications? Small required hydrocele does not need any treatment. Okay, so no symptoms, small hydrocele, no need for treatment. Okay, so when the scrotal mass is cosmetically unsightly, that means cosmetically is ugly or heavy weighted and very enlarged, and during walking it sometimes gives dragging pain. In that case, uncomfortable for the patient during walking. If any complication arises, like any trauma or any bleeding or any infection, in that case we have to remove it. And sometimes medical fitness purpose, because during some job like army, air force or any defense job, they need it should be corrected for selection. Okay. So some patients came for correction of hydrocele due to the job purpose, job criteria for corrections. Okay. So what complication may arise if hydrocele is not treated? If not treated, what complications? So there will be rupture, or there should be hematocele infection, atrophy of the testis, hernia of the hydrocele sac through the dartos muscle. Sometimes hernia hydrocele can become complex as a complex form, okay, through the dartos muscle, and calcification of the sac for the long time hydrocele. So what are the points of treatment? So what are the treatment? That is surgery, Lord's operation, that means plication of the redundant sac, which is been selected for thin walled sac. Okay, and Jabolis procedure, open and eversion of the sac, which is more popular nowadays. Excision and eversion of the sac, small and medium sized hydrocele. Okay, and excision and eversion of the sac, what it is, large size of the hydrocele we go for excision, that is Javulis procedure, and aspiration with or without injection. Sclerosing agents such as tetracycline sometimes given if the patient is unfit and patient don't want to go for surgery. In that case, we go for as aspiration and try to inject tetracycline as a sclerosing agent for patients unfit for surgery. Those are unfit, like extensive age group, like a patient with testicular malignancy. Sometimes they came with hydrocele. So in that case, we go for tetracycline injection. Tapping may be tried for the relief of the discomfort and for patients unfit for surgery. Aspiration and tapping has the following complications. Aspiration, that is high recurrence rate, infection, hematocele, and injury to the testes. Okay. So these are the complications, and treatment should be done. Now, what is the most common complication of this surgery? That is hematocele. That means blood can be accumulated through the sac. That's why to avoid this, we meticulously hemostasis every vessels, and also keep a drain with the keep a drain within the scrotal sac. That's why bleeding can be assessed. After eversion of the sac, secretion comes from exposed visceral wall, but why the collection does not accumulate in the scrotal wall? This is a question. Collection is cleared by subcuticular lymphatics. So there is a lymphatic circulation there, so that secretion will be sucked out or absorbed by subcuticular lymphatic system. Now there are some few topic related things you should know during before going to examine, because there are some other lateral questions your teacher can ask you, but they will give you the good marks. That is, what is hydrocele? Hydrocele is an abnormal collection of serous fluid in a part of a processus vaginalis. So now your teacher can ask, can you tell me what are the layers of scrotum? As it is an anatomical question, but in this case it is important. That is skin, dartos muscle, because there is no subcutaneous tissue fat here. Then processus, then the layers of external spermatic fascia, then cremasteric muscle, then internal spermatic fascia, then tunica vaginalis, tunica media, then tunica vasculosa testis, up to the testicular layer. Okay, so after the external spermatic fascia, there is a processus vaginalis, which is a remnant of peritoneum. Okay, so here this fluid may be accumulated. Then if your teachers want to ask what further the layers of it, that in that case you can tell him that tunica albuginea, tunica vasculosa testis are and tunica media, tunica vasculosa testis, tunica vaginalis, tunica media. Okay, so character of hydrocele fluid, that is amber color. So hydrocele fluid should, what would it look like? That amber color, sterile, contain albumin and fibrinogen. It does not clot. There is no clotting, and there is no nature of clotting because there is no clotting factor there. And in long standing case, it becomes turbid, and when it contains cholesterol or crystal of tyrosine, it becomes calcified. That is calcifications of the hydrocele sac. So cholesterol and crystal of tyrosine can be sometimes present, and it looks like a turbid collection. Now the types of hydrocele: congenital and acquired. Congenital, primary and secondary. Anatomical varieties of primary hydrocele should be congenital hydrocele, funicular hydrocele, infantile hydrocele, incysted hydrocele of the cord, and vaginal hydrocele, which is most common. And vaginal hydrocele may be present for it is as a congenital or due to traumatic, due to cause not idiopathic. Okay. Okay, that is all about the session of hydrocele. I think it is all that question can be asked in case of short case, because it's a very limited time period, 2 to 3 minutes for question answer session, and 2 to 3 minutes for examination. Mostly 5 to 7 minutes you can have for safe zone, to keep safe zone, because you have to complete 3 or 4 short cases in your PG exams, including your reverse test exam. Okay, I didn't go for that, but I saw their section 2 curriculum or exam style. That means 4 short cases you have to encounter within 30 minutes. That's why it's more likely 3 or 7 minutes is a very safe zone. Okay, thank you very much. Keep like and subscribe my channel, and keep watching my videos, and it will give me much more encouragement for future videos. Thank you very much. Peace.